If you're pregnant, chances are your provider will tell you it's time for the Tdap vaccine, the one meant to protect your baby from whooping cough. But here's what most women don't realize. While it's routinely recommended in every pregnancy, not all providers or moms agree it's necessary. So today we're going to look at both sides, what the CDC says, why it's recommended, and what concerns lead some women to decline or delay it. So the goal isn't to tell you what to do, it's to help you make an informed decision that you feel confident about. Hi, I'm Rachel Moises, a mother of 8.
And I'm Heather Shelley. I am a family nurse practitioner and a midwife.
And we are from the Mighty Mama Movement, an online birth education program that helps women have low pain births with our practically pain-free method. So let's jump into it, Heather. This is something in the United States, I don't know really about other countries how common it is or not, that is routinely recommended for every woman to do the Tdap. So can you kind of explain what their thinking is in recommending that, why they do that?
Okay. So first off, we are the most vaccinated country in the world. And so a lot of vaccines that are given here are not given in other countries. So many countries don't vaccinate for Tdap in pregnancy. So that is one thing to note, that it's not a global.
Worldwide.
Yeah. And the reason that we do the Tdap, or that the CDC recommends it, is to help reduce the severity of pertussis in the newborn infant, because typically the Tdap is not given until baby is about 2 months old.
Okay, pertussis being whooping cough.
Right. And so there is the Tdap, which is given to adults. It's tetanus, diphtheria, and pertussis. And then Tdap is diphtheria, tetanus, pertussis. And the reason for the order arranged, I'm going to tell you the way that my pediatrician explained it to me.
Okay.
I remember taking my baby to the pediatrician for whatever reason, and she had the vaccine calendar on the wall, you know, the big timeline through your life. And I said, what is the difference between Tdap and Tdap? Like, why does it change? And she said, it's the order of the kind of like the ingredient list that you see, you know, the first ingredient on your can of or box of whatever food has the most, and then the thing at the bottom has the least amount.
Oh, okay.
Does that make sense?
Yep.
So she said, if we give you the Tdap, if you've been vaccinated throughout your life, it will make you extremely sick. So we have to give you the Tdap, so the diphtheria is less. Because diphtheria, the vaccine, builds up in your system and isn't eliminated. And so if we give an adult as high a dose as we're giving a child, think about that for a moment, okay? If we give them as high of a dose, adult, it would be toxic for the adult.
Oh, okay.
And so
we're doing the Tdap with the lower dosing on the diphtheria.
And the reason we're doing the Tdap is because the vaccine industry did not want to separate it. It used to be...
I was going to ask, can you just get the
No,
the pertussis one?
You used to be able to have it divided, and then so you could just get the tetanus shot. So if you
can't even just get a tetanus shot anymore?
You can't. And then for a while they did it where you could do tetanus and diphtheria, and then they said, you know what? That's not cost effective for us as manufacturers. It had nothing to do with your safety. It had to do with money.
Efficiency.
And so they combined it. So every time you get something for pertussis or for tetanus, you get diphtheria, whether you like it or not.
I didn't realize that. I did get just a tetanus shot one time because I got cut with something rusty, but that was probably a lot of years ago.
Over 15 years.
Yeah, that was a long time ago.
Yeah, exactly. So that is one of the drawbacks, is you can't get just one thing. You have to get the combination.
So we're trying to protect baby from pertussis, but we're obligated to include the others as well. Okay.
Exactly.
All right. So, but the CDC is saying that you want to do it, you need to do it. What's their deal? Why? So, how big of a risk is the pertussis? And I know that it is serious for a baby to get pertussis.
Right. So it is definitely a serious thing for baby, because respiratory babies cannot handle respiratory issues very well. So for instance, if an adult gets pneumonia, they can go a good week, you're miserable, but you can go about a week before you're like, all right, I really need to go to the doctor now. Like, this is out of control. A child can go, maybe 3 or 4 days. An infant can go hours to a day. Like, they just don't have any reserves. And most people don't react fast enough when their baby has pertussis, or when their young child, their toddler has pertussis. They don't react fast enough to get the medical care that's needed. Because once you can get in for pertussis and they can start antibiotics and inhalers and nebulizer treatments and all of that, you can kind of stop pertussis in its tracks. Now, it will still last 6 to 8 weeks, but you can stop it so that it won't progress to be more severe.
To the point where it's dangerous.
Right. But because babies they can't handle more than a few hours a day at the most of it building up, people don't get their infants in fast enough because they think, I'm going to go to the doctor because it's only a $20 copay. I don't want to go to the emergency room because that's going to cost me a whole lot more money. So we'll just wait till Monday, and by then their baby is in critical condition.
Okay, so that makes me think maybe I should get the Tdap.
So,
is that what you're saying?
Well, once again, I am all about true informed consent and choice, not manipulation.
Okay.
So you have to look at, first off, there have been 0 studies done on pregnant women with the Tdap because it is considered unethical to do a trial on a pregnant woman. So the research that they have done is a reverse testing, where they have given the vaccine to a bunch of pregnant women and non-pregnant women. And then they have gone backwards and said, what were the results of this? And this is where you have to really look at the parameters and the controls that they did. So if you look at an insert, I know.
Okay.
If you look at the insert, not the informational sheet that your doctor will give you, but the actual little tiny insert that unfolds.
If you were to buy the vaccine.
Right.
Yeah.
One of the side effects of the Tdap is miscarriage or stillbirth.
One of the potential side effects.
Right. One of the potential side effects. And so, but you have to look once again at the parameter and the controls. So they said, okay, so between the women that got it and the women that didn't get it, they may say, okay, there wasn't a substantial increased risk of losing the pregnancy. But how many days did they do it? Did they say, well, within the first 24 hours, there's no statistical difference, but in the first week, there is. But they're not telling you that. They're saying in the first 24 hours, there's no statistical difference. And then they stop the study.
Oh.
And so you have to look at bigger parameters. So whenever they report it, they're like, yeah, no, it's great, it's good. But they're not following up beyond a day or 2 days. They're not following up for a week to seeing how many women lost the pregnancy or what the side effects were. So the theory is what they're saying is that when you give the vaccine, the antibodies cross the placenta and go to baby. Mm-hmm. So mom has now, and let me be very clear, you do not have immunity from pertussis. What it does is it lessens the intensity of the pertussis in the best case scenario. There is no immunity from the pertussis vaccine.
My friend's baby got pertussis about 6 months old from older siblings. She had gotten the first, I don't know how many you get
2 months,
before,
4 months, 6 months, yeah.
So how many vaccines would she have had by
6 months?
Then
at least 2, if not 3.
She still got to the point of turning blue and rushing to the emergency room.
So that is one thing I want to make very clear is you do not have immunity. You have a lessened chance of the severity, okay? So it's about 85 to 90% severity of it. Anyway, so chance of
That's important to know.
It
because
really is.
Women are being told and thinking, if I get this the vaccine, my baby will not get pertussis.
Right.
Like, no, not going to happen.
And that is not the case.
Okay.
So,
and also we're only talking about the first 2 months of baby's life, right? If they're
Right.
going to do, for women who are going to actually vaccinate their baby.
right.
Okay.
So there is passive immunity, there is active immunity. So let me just use measles as an example, okay, or chickenpox.
Okay.
So if I have had the measles, which I actually did have the measles as a child, or the chickenpox, I pass those antibodies on to my baby, even though I had it when I was 5 years old. Okay. So I pass those antibodies on to my baby. And as long as I am breastfeeding, I continue to pass antibodies on to my baby. Does that mean my baby won't get chickenpox or won't get the measles? No, but it means that severity will be much, much less. So for instance, my daughter got the chickenpox when she was 5 or 6 months old, probably about 5 months old. My son brought them home from kindergarten. And my 2 sons had, crazy case of chickenpox, like you normally would, right? And my daughter had a few pox on her body, and the most of them were on her face. And I like to say that's because she was smashed against my boob most of the time.
Spent her life cozying up.
Right. But because I passed that immunity. Now, had I been vaccinated against chickenpox, I would have had no immunity, because vaccination, you cannot pass that on to your child.
Oh, okay.
But natural
It's
immunity,
only natural immunity
you
that can, if you're breastfeeding.
Exactly. And so if she would have been formula fed, chances are she would have gotten a pretty big case of the chickenpox.
Okay.
But being breastfed, that really held it back. And so you do reduce the chance. So now let's say you've had the Tdap, okay? So your chances of getting pertussis are actually higher.
If I get it when I'm pregnant?
Just anytime you get the
Anytime.
pertussis vaccine, you actually have a higher chance of contracting pertussis, but you won't get it as badly.
Oh, okay.
Does that make sense?
Yes.
And so, and breastfeeding, you won't pass that immunity on while breastfeeding because it wasn't natural, but you can pass it through the placenta.
Okay.
So I know it's a little complicated, and there are pros and cons to each. So why would somebody want it? Because they would want to pass those antibodies on to baby, which last a couple of months until baby can get vaccinated. But once again, remember, vaccination does not mean immunity. It just means your baby has a better chance of having a less severe case of it. Okay. So what is some of the risk of you getting vaccinated around a baby? So is that you may have pertussis, but you have such a mild case, you don't realize you have pertussis. So then you go and you work with your baby or around the baby, and you don't realize you've given a baby pertussis. Let me give an example. So one of the hospitals I worked at, that one winter, I remember it was constantly on the news. They were saying a NICU nurse has been diagnosed with a pertussis. If your baby was in the hospital from this day to this day, please go get your baby checked immediately. Because what happened is she was vaccinated for pertussis. She just thought, I have the sniffles, I have a little bit of a cough, I feel kind of crappy, but there's no one to take my shift. I'll just go into work, I'm not that bad. It's just a mild something. And she didn't realize she had pertussis because she had a mild case, which is great for her.
Premature babies.
Right. Which is great for her. She had a milder case.
Right.
But not realizing she had a disease that was not good for babies, she went to work.
Oh.
And that wasn't just one. That there was multiple that winter that did that, which also tells me, why are the hospital not letting the nurses call off when they have a little cough?
Yeah.
Okay, so that's
Right.
a different thing there. But so you're more likely to pass it on because you think, I just have the sniffles, I just have a bit of a cough, like nothing major.
Yeah.
And then you expose, you spread it easier. So that's one thing. But you have less of a chance of having something severe, which is really nice, not to be peeing your pants every time you cough.
Yeah.
Okay. Why would people not want to get it? I've had pertussis myself, and immunity is for life. Once you've truly had pertussis, you have immunity for life. So I have no desire to get the pertussis vaccine.
Okay. And your babies would have been fine because if they were breastfeeding. So in that case, kind of don't need to worry about it.
Well,
too much.
I mean, not as much.
Well, I mean, you don't want to, you don't need to worry as much about getting the vaccination.
Right. And so, and once again, you know, that's a choice you have to make that way, the risk versus fact. I tell people, I won't make the decision for you because I don't have to live with the consequences on either side of the coin. I don't have to live with the consequence of not getting it and my baby getting very sick and spending weeks and weeks in the NICU. On the flip side, I don't have to live with the consequence of what's called the Tdap scream, which is the encephalitis that can happen to a baby as one of the side effects. And I actually have lived with that consequence. My first son had the Tdap scream. He screamed for his first month of life. Most likely, from looking back on it, it was every time he got the Tdap vaccination. And so, and my second child ended up in the hospital after his first Tdap vaccination. And so I've lived with those consequences. And so therefore, I will not make that decision for a parent. They must make that decision because I know what it's like to have a child that you wake up every 3 hours to give a nebulizer treatment to because of the reaction that they had from the Tdap vaccination, and a child that screamed for the first year of his life in pain from encephalitis. And so, and I've had a child spend 3 days in the hospital from pertussis. She was older. So I've been on both sides of the coin, you know, and you have to make that decision that is best for you. But it has to be an informed decision. It can't be, this is what you need to do. It's 100% effective and there are 0 side effects, because it is not 100% effective and there are not 0 side effects. There are potential side effects from mild to severe. It's not just, oh, they'll get a sore. They may have a sore arm and a fever. That's not, like, yes, that's
not the only potential side effect.
Exactly. And the other ones are 1 in a million. No, they're not 1 in a million. They are substantially higher than that. And once again, it just has to be your decision. It cannot be mine. But you can't make that decision if you are not fully informed of what the risks and side effects can be. So
I didn't do the Tdap in any of my pregnancies. I did not do that. I'm just thinking, okay, if I'm a pregnant woman listening to what you're saying, I'm scared about either option and I'm not happy about either option. But maybe what I would do, I mean, honestly, I didn't even think about this, but this is a topic that comes up a lot in our Facebook group. And so that's why we're talking about it, because a lot of women are wondering, like, well, should I do it or not?
Right.
And it's very polarized, kind of contentious discussion that you can have there. But I'm just kind of thinking, if I was a pregnant woman and trying to decide, and I am pro-vaccine, like I'm planning on vaccinating my baby, then I would kind of feel like, okay, you can get the Tdap at 2 months, the pertussis.
The Tdap is at 2 months for babies.
At 2 months, okay. So maybe
2, 4, and 6.
So maybe I'd be like, okay, the first 2 months, my baby is not going many places, not interacting with very many people. What if I'm just extra careful? I don't get it when I'm pregnant, and then I'm extra careful for a couple months until they can get that first one.
Right.
I don't know. I'm just saying, maybe that's what I would do.
One of the things that we do in our practice for those who don't want to vaccinate is we say, here are the things you need to look for in your baby, in your family. Because if one person in the family is diagnosed and that person is treated, and then they prophylactically treat the entire family, because of course it's highly contagious. And so if you notice your husband or one of your older children starts to have that whooping cough, that kind of, it sounds like a whoop. That's why it's called whooping cough, right? Get them tested immediately, because then they can give the antibiotics to the whole family to help stop it where it's at. And don't wait for each person to be diagnosed differently. Once that first person is diagnosed, get the whole family treated.
Okay.
And so that's one thing that you can do. We talk to parents about, we teach them how to use an infant pulse oximeter. We teach them a lot of these things so that we say, if you see these signs, call us immediately so that we can evaluate your baby, your child, and get them treatment quicker rather than waiting until Monday. So they can call our emergency line and say, hey, this is what you taught me, this is what I'm seeing, and we can get that taken care of rather than waiting and delaying it and causing bigger problems. So
a lot of just being more proactive when you've got a newborn can kind of really mitigate the risks of if they were to get pertussis.
And it's a hard decision to make. It really is. But I just don't want the fallacy that something is 100% because it's not. We say you shouldn't have tuna because of the mercury, yet these vaccines have mercury in them. Not for long. Those are being pulled out in the next couple of years, but that's not right now. So, we say don't eat sushi, don't eat tuna fish, don't eat swordfish,
while you're pregnant.
Don't do all these things. Oh, but you can have a vaccine with, aluminum and polysorbate 80 and, and all these things that's skipping the digestive tract and the liver cleansing and going straight into your system. That's why some women don't want to do it, because they're saying, wait a minute, I can't eat tuna, but you can inject mercury into me? Wait. What's happening here?
That's a good question to ask.
Right. And so, like I said, I'm not saying don't get it, and I'm not saying get it. I'm saying you have to be fully informed of all the risks of it and look at the research. When they say, well, the research shows, well, how far did that research go? Did that research only go 24 hours? Did it go 48 hours? Did it go 1 week? Or did it go 2 years? Because what really is the risk long term? So short term, in the first 24 hours, there's not much of a risk. But what happened after 24 hours? And you have to ask yourself, why did they stop the research at 24 hours?
I know, it feels so
Did they do it longer
shady.
And said, dang, that is not the data we wanted, so we're going to...
hope not. I sure hope not.
But you have to ask that question. That is science.
Yeah.
Science is saying, we are going to question the data.
And we want the real, accurate, best for the consumer solutions here in research.
Exactly.
So,
and the doctor I work with, he was like, at first he was like, I am very pro pertussis vaccine. Granted, his children, when they were young, you could get the individual vaccines because he accidentally brought pertussis home from the hospital and gave it to one of his babies who ended up in the NICU for a week. But if you ask that same doctor now, he wouldn't say to you, absolutely get the vaccine. He would say, here are the risks, here are the cons. On both sides of it, you have to make the decision because he's seen both sides of the coin as well.
Well, we're going to leave that decision up to you, and hopefully everything that we've talked about will help you make that decision. If you want to ask any questions down in the comments, go for it, and we will get back to you on that. And don't forget, we have a free online birth class, How to Give Birth with Practically No Pain, which is in the link. That doesn't have anything to do with vaccines or Tdap, but it does have to do with pregnant women who need to give birth and would like that to be a pleasant experience. So check that out if that interests you.